What is an ovulation? An ovulation is when the ovary do not release an oocyte during a menstrual cycle. Therefore, ovulation does not take place. However, a woman who does not ovulate at each menstrual cycle is not necessarily going through menopause. Chronic anovulation is common cause of infertility. The menstrual cycle involves a delicate dance of hormones in a woman's body. Hormone levels must rise and fall at a certain time to achieve ovulation. Ovulation happens when an ovary releases an egg in preparation for pregnancy. Ovulation is the stage of the menstrual cycle during which a mature egg is released from the ovary into the fallopian tube and is available for fertilization. Usually, one egg is released per ovulation cycle and the egg can survive for 12 to 24 hours after leaving the ovary. If the sperm does not fertilize the egg during this period, the egg disintegrates and gets absorbed into the uterine lining. Ovulation occurs naturally in most women. However, for women who are finding it difficult to get pregnant due to irregular ovulation, certain herbs may help them conceive in some menstrual cycle. An egg does not mature and a woman does not ovulate. This is known as an ovulation. An ovulation may occur. An ovulation may cause irregular menstrual cycle or no period at all. An ovulation disrupts woman's menstrual cycle. This can cause problems such as infertility. Some medications, conditions, and external factors that affect hormone level can cause an ovulation. Sometimes, a woman may have an ovulatory cycle and then go back to regular cycle. Other times, it's a chronic problem. When an ovulation occurs, a woman cannot get pregnant. For women who have completed menopause, this is a quick normal. Women of childbearing age do not usually experience an ovulation unless something has disrupted the body hormone level or damaged the ovaries. Symptoms: women who ovulate regularly often see signs that occur during each cycle. They may experience the following: increased amount of cervical mucus, a drop and subsequent rise in resting body temperature in the middle of the menstrual cycle around day 10 to 16. Periods that occur regularly: women with very irregular period or who do not see signs of ovulations may wish to try an over-the-counter ovulation predictor kit. This kit measures level of hormone in a woman's body to determine when she is ovulating. A doctor may also be able to test a woman's hormone level or carry out an ultrasound scan to view the ovaries. Steroid, a type of hormone that can reduce inflammation. They can also interfere with the hormone needed for ovulation. Cortisone and prednisone are common types of steroids that are prescribed for variety of illness such as allergies, lupus, asthma, and more. Topical steroids are used on the skin to treat inflammation and allergic reactions. An article in Annals of the Rheumatic Disease found that half of the women who received a steroid shot had an irregular menstrual cycle afterward. Epilepsy or seizing drug. This medication may interfere with ovulation and the menstrual cycle according to an article in Journal of Human Reproductive Science. Some epilepsy drug may also cause congenital disability, so people taking this drug should discuss pregnancy plan with their doctors. Cancer treatment. Chemotherapy, radiation and cancer drug can cause permanent damage to the ovaries. If someone is trying to get pregnant and has not had success, they may wish to discuss their medication with a doctor. In some cases, the doctor can prescribe an alternative medicine or may consider a drug to encourage ovulation. There is a high risk of experiencing ovulation in women who exercise a lot, are stressed or are underweight or overweight. Certain health problems can interfere with the body proper balance of the hormones that are critical to ovulation. These include conditions that affect the thyroid, adrenal, hypothalamus and pituitary gland. All of these glands play a role in the delicate hormonal balance that lead to ovulation. Polycystic ovarian syndrome affect up to 20% of women of childbearing age according to the National Institute of Health. Women with this condition usually have too much insulin and testosterone, which may disrupt the hormone balance and lead to an ovulation. Fortunately, these hormone-related conditions are often treatable. Many women may be able to achieve ovulation with proper medical treatment. Weight gain or loss may also be closely linked to ovulation as the hormone estrogen rely upon a healthy body weight for normal level. A study in Human Reproduction found that women who were either very underweight or overweight had decreased estrogen level, which can lead to an ovulation and fertility problems. Women who exercise excessively or who have high level of stress may also experience an ovulation because of disrupted hormone level. An ovulation may occur with premature menopause, also known as premature ovarian insufficiency. A woman may be diagnosed with this if she stopped ovulating before age of 40. The cause of premature menopause is often unknown, though some medication and condition can cause it. Some women who are experience early menopause can be treated with medication to stimulate ovulation and achieve pregnancy, and also can be treated with herbs and roots. Treatment of an ovulation. For many women, an ovulation became an issue when they want to get pregnant or they have irregular menstrual cycle. Because many different factors influence women hormone and menstrual cycle, there is no one solution for treating of an ovulation in many cases. However, the underlying causes of an ovulation or the issue that is affecting the hormone level can be diagnosed and treated. Treatment can lead to pregnancy or more regular menstrual cycle if she desire. If a woman suspect that she is not ovulating, she need to act fast if she wish to conceive. How to indulge ovulation naturally. Dealing with infertility can be frustrating and painful, but don't give up on your dream of having a baby. If you are not ovulating regularly, getting pregnant is very difficult. You may be able to improve your chance of conceiving by taking herb remedies and adopting health habits. However, try herbal treatment. Additionally, talk to your doctor if you feel being try to conceive for a year or you don't know why you are not ovulating. 1. Try out milk tasting to help your body use estrogen better. Milk taste is an herb that may detox the liver. This may help your body process estrogen better. What that means is your hormone may be better balance, so you may start ovulating more regularly. You can take 20 to 300 milligram up to 3 times a day. Always ask your doctor if you can take supplements safely. Second, state bearing. Job tears. Second, drink it. Take a drink of job tears to potentially help you ovulate. Job tear has been used in alternative medicine to induce ovulation. While most evidence is anecdotal, it may help you to make a tea of leaf by steeping them in a hot water. You can also take the seed as a supplement, which may have also help induce ovulation. 3. Seed bearing. To help your body produce more luteinizing hormone. Seed bearing may help increase your chance of ovulating, as some women find it beneficial. It likely works by telling your body to produce more luteinizing hormone, which in turn promote ovulation. By trying to take 160 to 240 milligrams once a day in the morning. You should not take this drug if you are also taking birth control pill or hormone. For add tribulus terrestris to your regime near ovulation. Ask your doctor about which day during your cycle you should take this app. Some women find it helpful for ovulation. Try 750 milligrams once a day. 5. Use a sinus herbal mixture to help your fertility. Many women have lucky using Chinese herb to help induce ovulation. You should be able to find the Chinese herbal mixture specifically for fertilization at Chinese herb store. Look for ingredients like dankui, gangguai, baozao, and zhuangzhong. Speak to your healthcare provider, acupuncture, or register herbalist to determine the best combination of herb for you. Go for some acupuncture to help with your hormone. If needle don't bother you, acupuncture may help with ovulation. In some women, it lowers the level of follic stimulating hormone when it is too high. For instance, if you have polycystic ovarian syndrome, your follic stimulating hormone level might be too high, which in turn can mess up your cycle and how you ovulate. Don't worry, the needle used in acupuncture are very small and most people don't find them painful. And this acupuncture in Korean, most of the Asian countries, they love acupuncture more than herb, and they practice it more than the African and Western region. But it's one of the best treatments you can have to get your hormone or to get your ovulation back to normal stage. Flashing oil comes from the seed of Lume Ucitaceae or flash plant and is available in liquid and capsule form. It is rich source of polysaturated fat acid that help maintain the ovary health of woman and thereby improve fertility. Say George Chavero in the book The Fertility Diet. Flaxseed oil also contain phytohormone and lignans that help balance the hormone level within the body and regulated the menstrual cycle and ovulation. The supplement may lead to gastric disturbance. They may also interfere with certain medication, hence flax seed supplements should not be used without the supervision of a doctor. Vites. The dried fruit of vites or Vitis agnus castus plant is used to make the vites supplement, which may help regulate hormone production in the pituitary gland and rectify ovulation irregularities. Vitis supplement may however cause side effects such as diarrhea, acne, stomach cramps and headache. Several allergic reactions may also occur. Dosage depend upon the age and the overall condition of the patient. Drug come also recommended talking to a doctor diagnoses the actual cause of irregular ovulation before using Vites. Glutathione is one of the best medicine you can also take when you are looking for fertility or when you want to conceive, you wish to conceive a baby. You can make use of glutathione. The whole worldwide have known about this glutathione and it's just like a miracle leaf. You can try. Get a wonderful cola, ginger and garlic, cut them into pieces, then get a 35 cl bottle of lime orange juice and then pour the ginger and garlic you have cut into pieces earlier, then drink 3 spoons before me in the morning and before bedtime and at night. Or extract aloe vera juice and mix it with half glass of cup of water. Drink the mixture for 3 days every morning. These two options here is one of the best options that Africans, especially Nigeria and some neighboring countries are using, and it has been working for them miraculously. But you have to be very careful because immediately you see your period, you have to stop this thing because if you are pregnant, it can lead to miscarriage.